everyone. Hello guys, welcome back to my channel. Okay, so guys, today we are going to be doing constipation management and diarrhea management for hospital setting. Are you a professional nurse practicing in the hospital, or are you a nursing student trying to write your professional examination? Are you planning to write your NMC OSCE examination? Are you a professional nurse at all you are practicing? This video is for you. All right, so stay tuned. I'm going to take you through on the management of constipation. I mean the nursing care plan on constipation and nursing care plan on diarrhea. Okay, so let's dive into what we have today. But before we move on, still remember that I am your favorite nurse gold. Okay, remember to subscribe to this channel, comment, like, and share to your loved ones. All right, so guys, let's dive into what we have today, which is constipation. All right, so first one, the nursing problem is Mr. John is experiencing constipation. Make it simple. All right, or Mr. John is having constipation. All right, under the nursing aim, Mr. John will show less signs of constipation after nursing intervention. Simple. All right, and then the next one is the evaluation day. Mr. John is to be evaluated today, 10/2/2025, every hourly and as clinical condition changes. Okay, the next one now is I'm going to use a bit of rate and then other things in order to cover all the important points needed on the management of the care plan. Okay, so one is rate. Explain all aspects of nursing care to John and gain consent for all the nursing intervention. All right, you are explaining all the aspects of nursing care to John and gain consent for all the nursing intervention. The next point is monitor John's vital observation and escalate according to NIST policy. Okay, monitor John's vital observation and escalate according to NIST policy. And the next point is assess John's level of constipation using Bristol stool charts and escalate to the nurses and doctor in charge. Okay, and the next point is to encourage John to take copious fluid intake, at least 2.5 liters a day, to prevent constipation. Okay, and next one is under the next one, you collect the stool sample and send to the lab to find out the cause of the constipation. If is medication such as morphine. Okay, and the next point is to encourage Mr. John to take fiber diets as well as fruits and vegetables to reduce constipation. Okay, and next point is encourage Mr. John to involve in movements, or encourage Mr. John to be involved in activities of daily living, all right, such as walking. That is one of it, okay. And then next point is identify the need for frequent assessments, or identify the need for continuous assessments. All right, and the next point is liaise with the doctor to prescribe laxative for Mr. John to reduce constipation. Okay, and the next point is educate Mr. John in side effects and indication of his due prescribed medication. Okay, and the next one is administer due prescribed medication to Mr. John and assess its effectiveness after 30 minutes of administration. All right, and then another one after administration of the medication is Encourage John to make use of the call bell and ensure that the call bell is at his reach. Okay? And the next one is to documentation. Document all the care rendered to Mr. John with signature, time, and date. And that is it for management of constipation. All right? And then the last one under hospital setting is diarrhea. Okay, and then under the diarrhea, the nursing problem is Mr. John is experiencing diarrhea or Mr. John is having diarrhea. What is our nursing aim? Mr. John will show less signs of diarrhea after nursing intervention. All right, next point is the evaluation day. Mr. John will be re-evaluated today. Make sure you are putting the date. When you say today, you put comma, date 10/2/2027 or 10/2/2025, depending on the day. And every hourly and as clinical condition changes. Mr. John will be re-evaluated today, 10/2/2025, every hourly and as clinical condition changes. Okay, now we move over to hematite. I'm going to use hematite, but not all, because I'm going to make sure I put all the necessary points for this management of diarrhea. All right, so explain all aspects of care to Mr. John and gain consent for all the nursing intervention. Explain all aspects of nursing care to John and gain consent for all the nursing intervention. Okay, now monitor Mr. John's vital observation and escalate according to NISTU policy. Okay, the next point is assess John's stool using Bristol stool charts. Okay, and escalate to doctor and nurses in charge. All right, and then the next one after you have assessed is to encourage John to take adequate fluid intake to prevent dehydration. All right, and then also another point is encourage John to reduce intake of fruits and vegetable to prevent diarrhea. All right, the next one is encourage John to promote good toilet habits, such as sitting a long time in the toilet and maintaining toilet hygiene. Okay, and the next point is to collect the stool sample and send to the lab for proper investigation to find out the cause of the diarrhea, which can be medication such as antibiotic or norovirus, okay, or food poisoning. All right, and then after you have identified the cause of the diarrhea, you are now going to liaise with the doctor, okay, to prescribe anti-motility medication for Mr. John to reduce diarrhea. And then you now teach Mr. John the indication and side effect of his due prescribed medication. Next point is to administer Mr. John's due prescribed medication and monitor its effectiveness after 30 minutes of administration. All right, and then encourage John to make use of the call bell and ensure that that call bell is at his reach. Okay, last but not the least is identify the need for continuous assessments for Mr. John and ensure proper documentation with your signature, time, and date. This is it. That it is. Okay, that's all. All right, so guys, you people can do this. If I can, you can do it. Just believe in yourself. OSCE is simple. Exam are simple. It's just because of anxiety and the stress. Okay, just believe in yourself that you can do it. All right, nurses are brilliant. Nurses are beautiful. Okay, all right, thank you so much, guys. Still remember to subscribe to this channel, comment, like, and share this video to all the beautiful and handsome nurses out there preparing for their examination, practicing in the hospital. And this video is going to be very helpful to any of this. All right, thank you guys for sticking to this channel. Go choose, love you all. Bye.